a 32-year-old woman, confusion and decreased urine output, fatigue and bruising, no history of diarrhea or recent travel, mild jaundice, petechia, altered mental status, anemia, thrombocytopenia, renal failure, high LDH, high indirect bilirubin, schistocytes. Which of the following is the most appropriate immediate management? So here we see hemolytic anemia, explaining this high LDH and high indirect bilirubin, which also explains this jaundice. Also we see thrombocytopenia explaining this petechia. And we have schistocytes and neurologic manifestations like confusion, altered mental status. So this is a typical TTP case, thrombotic thrombocytopenic purpura. It always comes this way, with hemolytic anemia, schistocytes, and thrombocytopenia. Always comes this way. And sometimes with renal failure, like we got here, the patient has decreased urine output and high creatinine. Sometimes with neurologic manifestations, sometimes with fever. And you should know it looks like another disease called HUS, hemolytic uremic syndrome, which also comes this way with hemolytic anemia and thrombocytopenia, but the pathogenesis and treatment are different. Also, some symptoms may be different, as fever and neurologic symptoms are mostly with TTP versus HUS, which more often follows diarrhea and cause renal failure. That's why in our vignette there is no history of diarrhea, to stress on this point. Also, TTP mostly occurs in adults, unlike HUS, which occurs in children. And in the pathogenesis, TTP is usually an autoimmune disease, as antibodies decrease ADAM TS13, and this leaves von Willebrand factor multimers uncleaved, which cause platelet trapping and activation. This is versus HUS, which occurs due to Shiga toxin producing bacteria, which is a type of E. coli, specifically E. coli 0157H7. And that's why you should never give antibiotics for something like enterotoxigenic E. coli if a patient has diarrhea, because if you kill the organism, you might spread the toxin and cause HUS. And this is very, very important to know. And now for treatment, which is why I made this question, you should never forget it. It's very, very important. The correct answer is C, plasma exchange. Because without it, there's 90% mortality risk. So never forget this treatment. Then you might give corticosteroids or eculizumab, but this is not the first step and it rarely comes as a choice. The most important to know is plasma exchange. And of course in HUS we treat by fluid and electrolytes first. Then we do dialysis. So always remember this too. And here are our side notes which I recommend you to read.